What's going on, Reno? Let's see if we can get some people. I know we're later again than usual, and you're never going to believe this. I hope I can get some people jumping on here, but we were on here a little earlier, and Facebook was keeping my movie is automatically moving everything down to personal and for me only, private for me only. So we just were on here about 30 minutes ago. No one joined on, so I hopped off. So I'm gonna wait a few seconds here and let some people join, get some of my peeps in the comments. I know some of you have been probably waiting for a minute. I apologize that it took a few extra seconds here to get going, but let's get into things. This is going to be another quick discussion on more of the nonsense that's plaguing our community. We're talking about business closures again. We're talking about restrictions to business. We're talking about our kids being stuck home out of school until January 19th. It's insane. So we're going to run through some stuff here quickly, guys. One thing that I think is really awesome, if I could have someone throw this up, I want you guys to look this up. COVID-19 mortality, a matter of vulnerability among nations facing limited margins of adaptation. If we could get that up there, I don't know, let's see who's in the comments already. I'll tell you how quick this is going to happen. I hope Melissa Brown is out there tonight somewhere. But what does this end up doing? This entire study talks about that no matter what the governments did, no matter how severe the restrictions were, no matter what they did, it did nothing. That's what this article says. Go look it up, okay? COVID-19 mortality, a matter of vulnerability among nations facing limited margins of adaptation. It said that despite the different methods of the lockdowns, despite how governments responded, it did not make a difference. It's a virus. And you see people say, virus gone virus, we have fun with it. It's true. It's a virus. It's going to happen. And guys, I'm going to pull out my map. Don't even pay attention to this map. This is not an election talk tonight. We're not even getting into the craziness of that. We don't have time. We're going to keep this short and sweet. This is about the coronavirus. This is about Reno, Northern Nevada, our rural communities. Southern Nevada is about Nevada right now. But I want to throw this up. I always throw this up. Why? Because if someone could please explain to me how they have school and sports and all these red states down here, all these reds all across here. Remember, the warm weather was going to create the death, all right? So now here's the warm. We're in the colder weather. It's cold and flu season. Our hospitals are at the same capacity they're at every year. And someone, before you jump, Joey, that's not true. Bam! I laid some stuff out tonight. Southern Nevada hospitals released statements saying facility capacities remain sufficient. Governor Sisolak, why would you order any type of a stay-at-home order? They're even booking elective surgeries down there still. I talked to them. I talked to the doctors down there. I have more information on that tomorrow. The Northern Nevada hospitals are seeing more patients than they normally see, but what have I found from the doctors here? They say majority of the people are coming in. They should have been seen earlier. They're people that waited too long on certain things. Almost everybody comes in, thinks they have coronavirus, comes in super anxiety, panicky. They think they've got flu. The majority of them have flu. That's what's happening. But let's carry through. So there's that document I want people to look up. Then this was out. This was a study down in Denmark. Denmark study. Effectiveness of adding a mask recommendation to other public health measures to prevent SARS coronavirus infection in Danish mask wearers. If we could get this thrown up, this goes through the whole thing to say that let's see, there's a total of 330 participants were randomly assigned to the recommendation to wear masks, and 2,994 were assigned to control. 484,862 completed the study. Infection with SARS coronavirus occurred in 42 participants recommended masks, so 1.8%, and 53 control participants, 2.1%. The between group differences was negative 0.03 percentage points. An odds rate, multiple imputation accounting for loss to follow-up yield similar results. Although the difference observed was not statistically significant, the 95% CIs are compatible with 46% reduction to a 23% increase in infection. So I'll just cut through the chase through this. Not statistically significant. That's a big difference, guys. For all you guys there, do your part. You're killing people. Actually, people like jump out of the way if you're not wearing a mask. Not statistically significant. Under results, see that second to last paragraph? Difference observed was not statistically significant. That's for the mask. This was just this is November 18th, 2020, out of Denmark. Go see what they did in Denmark. Again, just you guys remember this. This is the Argentina mask. They implemented the mask in April, and it just kept climbing up because of gun virus, right, guys? Remember that, everybody? So we're here tonight talking about Governor Sisolak calling for more stay-at-home orders. That's what we're hearing. As insane as that sounds, he's doing it. His daughter cryptically put out an Instagram message about, see what's going to happen in 9 days. Don't be mad when y'all get locked down, and ha ha ha, I'll still be doing what I want to do. You know, because if you guys think that the elected officials aren't having private parties behind closed doors, you're crazy. They're doing it. Gavin Newsom just got busted. Nancy Pelosi was having her hair did. Governor Sisolak's been out to numerous restaurants. He's having food everywhere. He's in live music. Like, they don't care. They don't care about you. They're going to do what they want to do. And I've been in meetings with all these people, and as soon as the doors are closed and the cameras are gone, we take the masks off. So lie if you want to lie. Lie and pretend it doesn't happen. But no one wear it because they know they don't work. That's why. So another thing, if you could find this one, whoever's out there, this is we need a Hippocratic oath for public health officials. I don't know why we need this. It shouldn't happen, but it's happening. Here's something everyone's got to know. While many states have not experienced significant excess mortality due to the coronavirus, they have experienced significant excess mortality due to lockdowns and our responses to coronavirus. Specifically, on average, 42% of the excess deaths in the United States are not due to COVID. This means for every person who dies of COVID, roughly one person who wouldn't die otherwise dies for some other reason. Put another way, normally, if, as of our writing, our deaths per million from COVID were 701, our non-COVID excess deaths from COVID response were 270. These deaths are in younger, healthier populations with decades to live, compared to the average coronavirus death, which is identical to the average age of death in the U.S., 78. Not surprisingly, the hard lockdown, early peaking states of New York, New Jersey, Connecticut, Maine, Rhode Island, Michigan, and Louisiana have worse numbers, with an aggregate showing 360 deaths per million for non-COVID response deaths, 20,000. This is in addition to the 1,406 COVID deaths per million in these states, 78,063. This is harm in some states such as Oregon, Utah, Maine, Alaska, and Vermont. The ratio of non-COVID to deaths, of COVID excess deaths, is much higher. Again, what this means is that in these states, significantly more people are dying due to responses to COVID than to COVID itself. Holy smokes, guys. In some cases like Vermont and Oregon, a significant preponderance of the excess deaths are non-COVID deaths. This is the reason for grave concern. The average age of death for COVID is 78, identical to the average age of death in the United States. Thus, every COVID death that is prevented does not actually translate into increased life years on a national basis. However, the age of these lockdowns, COVID response-related deaths, is much younger, truly deaths that should not happen. And you're talking about putting the schools on distance learning till January 19th. Have you lost your mind? Who decided this? Where did we, the people, have a part in this process? Where was the public hearing? Oh, we can't have public hearings? Governor Sisolak, you can't have a public hearing? You can be out for live music. You can be out for dinner, but you can't have a public hearing? I'll even wear your stupid mask in a public hearing. Let me in there with my epidemiologists, my doctors, my people that got degrees in public health. We will shame you. You will look like a complete imbecile if you take a public meeting with a group of people. And how about this? How do you explain to the people in these states, how do you with a straight face tell parents here in Nevada that In these states like Arizona or Texas or Louisiana or Alabama or Florida or Georgia, where they're playing full football, packed stands, how do you tell them with a straight face that you got to send your kids home till January 19th? How do you do that? Guys, how do you do it? This is not a different virus. People are driving back and forth from these states all the time. How can you say that? It's just insane. It's insane. So, again, these trends hold nationally as well. If you remove the 7 early peaking states of New York, New Jersey, Connecticut, Maine, Rhode Island, Michigan, and Louisiana, the U.S. has never exceeded the weekly deaths we observed during the 2017-18 flu season. We haven't exceeded those deaths even with coronavirus this year. So you people that scream, like, tell that to the 225,000 people, they probably would have lost them anyway. Okay? I hate to, well, I mean, how old were they? Were they 78? That's a normal death. I mean, I'm not trying to be insensitive here, but people were going to die anyway. And again, I can read it to you one more time if you're ready. These trends, if you remove the 7 early peaking states of New York, New Jersey, why do we have to remove them? Because complete morons in government, like Governor Cuomo, sent COVID patients to nursing homes. He did, just like she did in Michigan. Whitmer is a sick person, sick, like Sisolak, okay? So, again, the U.S. has never exceeded the weekly deaths we observed during the 2017-18 flu season. Did you get that? So we're not even past that yet. Nationally, we're also seeing 1 preventable non-COVID excess death for every 2 COVID deaths. You can see that in the figure below. If we did not have the non-COVID excess deaths, our excess death for the other 43 states would be below the level, of a standard flu season. The preferred approach of our public health officials is doing harm. Guys, what we're doing is doing more harm than good. And of course, as you know, I always have the science. So Governor Sisolak, coronavirus task force, you've seen me hold this up how many times now? Stats hold surprise. Lockdowns may have little effect on the COVID-19 spread. This one was from October 4th. This one, from, like I said, the most recent one is, this is the randomized trial. Where is the most recent one I told you about? The Frontier Health one. So the Frontier Health one is saying, what is it? Frontier Health. Oh, Frontier Health. Okay, I've told everybody, go look at this one. This Frontier Health one, again, one more time, COVID-19 morality. This one says that no matter what the governments did, no matter what y'all did, there was no difference. There was no difference. So the lockdown stay-at-home order made no difference. It's a virus. Okay, so that goes through that. It goes through that. Again, coronavirus experts join global anti-lockdown movement. Like this, guys, we're still doing this. We're going into the 9th month. I'm still talking about this. I can't believe I'm talking about this. I can't believe I'm wasting. Some of you guys are probably so sick of hearing about me talking about this. I got better things to do. But there's kids dying now. Literally, the coronavirus, WHO backflips, the World Health Organization backflipped, advocating against lockdowns. Governor Sisolak, you're going against all science. All science. Very, very smart people, way smarter than me, have said what you're doing here. This lady, we've talked about her. How many times have we talked about Miss Gupta here? Dr. Gupta. Okay, professor from Oxford University. Pretty smart lady, right? What does she talk about? She talks about that we'll be reaching herd immunity, that the lockdowns are not necessary and too costly. The social costs of lockdown. Governor, we have an epidemic, okay, now happening. It's a suicide. That's the new thing you're creating with this. Thousands of Nevadans are out of work. Thousands more have kids at home. They can't help them with their studies. Okay, that's not how this is supposed to work. These kids are suffering and they're taking their own lives. We have record numbers of kids thinking about suicide in a month. That's tripled what they would have done in a year. Not tripled, it went from 25% in a year to like 125% in 30 days. That's insane. So how do you want to lose these kids? You want to have a few extra kids down at Renown? or in St. Mary's where they're not using the proper medication. And I just found out something earlier today. There's a pulmonary group that's a bunch of little sissies, and they're going to stay in the black and white. They're not going to do anything out of the ordinary. They're not going to use medications that they're going to stick to the straight and narrow. I just found out about you guys tonight. I think you're going to get a lawsuit. You took an oath to do no harm. So you have to use every available medicine, especially if there's any FDA approved medicines. That much I know. Well, you'll see that. That'll be coming soon. But again, guys, so as we talk about all this, stay-at-homes. Why are we talking about the stay-at-homes? Everybody's going, I see now there's a line, people getting tested. What did I tell you all about the test? Stop taking the test. Stop getting tested if you're not sick. It's insane. They're not testing for flu anymore. So influenza's disappeared, but I've got doctors saying people are showing up, presenting at the emergency room with influenza, with flu-like symptoms. They're all freaked out. They think they're dying from coronavirus. They've waited till... Stop. Just stop. Why? Your coronavirus test is positive. Maybe it shouldn't be. That's one article. The PCR test is unreliable. Why are public health officials demanding the public be tested? Why are they throwing up all these free clinics? Hey guys, you're going and getting tested, and Kevin Dick, this idiot, is using the test. They already knew. They did a study back in July here at the University of Nevada saying 5 times the population is infected with this disease than we have had tested. We know that. There's people you're coming into contact with every day that probably have had the coronavirus, might even have it, might be asymptomatic. About 60% of people will never even know they had it. Okay, this is not new stuff, everybody. They're just not telling you this. News Channel 8, News Channel 4, News Channel 2, Fox 11. Why? Why not? Why can't you can't show these documents? People will believe you over me, I guess, a little more. Probably not much longer. You guys are killing yourselves. How about this one? PCR test prone to hatching false positives. Did you know that 4 out of 5 tests of the tests that we use here in Nevada, Massachusetts, and New York are false positive? Yeah, that's true. And here's an even bigger one that just came up today. Not today, earlier this week. Portuguese appeals court deems PCR tests unreliable. They're not even allowing them in Portugal anymore. Do you want to know why? Because they said that they don't think, what did they really say? They just said that they're using these numbers to scare the heck out of everybody and lock down economies and do more harm than good. So they're getting rid of them because they said that they're unable to declare anything besides that they're finding a fraction. Okay, they're finding a small amount of the virus protein, the RNA in there. It could be an old coronavirus. You could have had coronavirus earlier this year, 3 months ago, 4 months ago. You could have had a different coronavirus. It's going to show up. That doesn't diagnose level of infectivity, any of that stuff. They're ridiculous. Again, I'm not making this up. Do you see that? So these same tests that they're using to lock everybody down across the world now, they're slowly saying we probably shouldn't be using these. Okay, again, you guys have talked about this before, the Great Barrington Declaration. I'm going to keep bringing it up. Why? Because it's still relevant. You've got now tens of thousands of health professionals from across the world have signed on to this, saying that lockdowns, that you need to have a more focused protection approach. We know who to protect. We know how to protect them. And now, based off this pragmatist, we know that the average coronavirus death is 78, and the average age of death in the United States is 78. Like, are you kidding me? Like, how are you guys letting this get over on you anymore? I mean, I could keep going with this. It would blow your mind if I kept reading through this. But the fact that we're not so you're going to tell me that the flu is down 98% worldwide, and that's not why Renown's busier than usual? The flu and the coronavirus, and everybody thinking they got it. They should have been putting everybody in that parking garage thing they built for the last few months and keeping them out of the normal hospital. Like, hello? And guys, again, I was saying this earlier. We're going to keep this one way shorter. But do you want to know how y'all can help yourselves right now going into this flu cold season? Your health, okay? Check your health. Are you taking vitamin C? Are you taking zinc? Are you taking vitamin D? Take a good amount of vitamin. Look it up yourselves. Research what you should be taking: vitamin D, vitamin C, zinc, drinking lots of water, staying away from alcohol and sweets. Why? Because it's bad for you, number one. Number two, right now, give your body the healthiest environment you can. And your older folks, get back to walking outside, get back to breathing, take that stupid diaper off your face and go breathe some fresh air, okay? Go look at what happened in the Spanish flu, what most people died from during the Spanish flu. They end up contracting bacterial pneumonia from wearing the masks. Again, guys, we'll finish with a couple more. CDC study found that evidence most who contract Corona-19 frequently wore masks. Wasn't the people not wearing them. And again, I've already had this article posted a few times. If I could get this up there again, physicians, masks don't control viruses, they control you. The pandemic is over. These are board certified, Ivy League trained doctors, the smartest of the smartest. They're not some of these complete squares and people in Reno that have no clue, because the chances are if you end up in the IU at Renown, they're not using the most advanced medicines. They're not using cutting edge stuff. They're not using stuff outside of the body. They can't, I don't know. They won't think outside of the box. All right. Demand the different medicines out there. I'm not going to say it because I found out that by me saying this certain medication you guys have heard about me talk about a long time, if someone could put it up there, you know, it's the H word, is getting me banned. It's actually getting me deplatformed by talking about a very cheap medication that's now available in the state. And again, if Renown, St. Mary's, Carson, Tahoe immediately put these people on this medication as soon as they present it, along with vitamin C, vitamin D, and zinc, and azithromycin or doxycycline, you would have probably 98% less death. That's not me. This is from the early onset of symptoms. Doctors across America, and anybody that wants to talk one of these doctors, anybody wants to get up there and tell me I'm full of it, go look at these doctors. Okay, look at Dr. Zelenko in New York City, what he did early on. If you treat this virus early on, Carson, Tahoe, Renown, St. Mary's, early, with the medications that many doctors are using, it's not, hocus pocus anymore. It's not a dangerous drug. Do you know that in the therapeutic use of 200 milligrams of this medication used twice a day, there's been 0 issues with heart arrhythmia? Do you know that in the Department of Defense that we've been putting American servicemen and women and DOD personnel on this medication for 40 years? And do you want to know how many times they've had people sent home with heart arrhythmia or problems with their heart when they've been taking a therapeutic dose? Why don't they want you to know that? I don't know. Again, documents that back in August, they're talking about herd immunity is still key to fighting this pandemic. But now we're talking about closing down again. Governor Sisolak, I don't know what your deal is, man. I don't know if you just want to kill this state's, businesses. I don't know what you're up. Maybe it's because you're not from here. You came from Wisconsin, from Milwaukee. Maybe you don't love this state like we do. But what you're trying to do to this state is insane. It's insane. Okay, you have kids down in Clark County taking their own lives. We have more suicides and more problems emotionally for our kids than we have from coronavirus deaths. So this shouldn't be rocket science for you, buddy, okay? I could bring in a panel of doctors, some epidemiologists, some guys with degrees in public health from states that are open. If you want to deal with it, if you're scared, we'll get some people from Texas, Florida, Georgia, even Indiana. Grab a couple people from South Dakota. We'll get the governor from South Dakota. I got to meet her in Florida. Very smart lady. And again, because the lockdowns don't work, she's not going to do them. So again, I don't know what other documentation you need to talk about why we shouldn't lock down anymore. But what you're doing to these kids is criminal. It's unconscionable. And teachers, the fact that you're allowing this and not screaming to get your kids into school, this is going to destroy them academically. They cannot hang on. You're trying to tell me that these kids are going to be distance learning till January 19th? Have you lost your minds? Where were the public hearings about this? Why couldn't we come in and talk about it? Again, look up this pragmatist, ladies and gentlemen. Read this. Read this on why we do need a Hippocratic oath for public officials. What's been allowed to happen in this state is absolutely criminal. It's unconscionable that we're still 9 months later. Joey Gilbert is still on Facebook talking about locking down and saying to you, and this is the last thing I'll leave with, 2 last things. Number 1, don't do it. Do not agree to be shut down again. Don't do it. Stick together. There's strength in numbers. How will they shut down all of us? If you just say no, I'm not saying don't stick with their little masks. Most important thing you can have people doing is washing their hands, sanitizing where it's transferred by the touching, okay? If it wasn't, there would be no airplane travel. 9 million Americans flew last week on conditioned air, reconditioned air in airplanes. Explain to me that. Riddle me that then, geniuses. And you're allowed to take your mask off to eat and drink on the flight, but you're all breathing the same air for 5 hours. Oh boy, you'd have to be in a bug suit. So the last things we're going to say is do not lock down. Sheriff, Balaam, I hope you will follow what they're doing down in Orange County. I'm going to show you a picture I just took. I'm going to post this later, okay? I hope you can see this. I really do. It's from Sheriff Barnes. From Sheriff Barnes down in Orange County, ladies and gentlemen, all right? Sheriff Barnes said earlier today, the Orange County Sheriff's Department became aware of a limited stay-at-home order that Governor Newsom's office ordered to go into effect Saturday, November 21st at 10 p.m. because Governor Newsom is insane. Throughout the pandemic, the Orange County Sheriff's Department has taken an education-first approach with regard to the public health orders. We are currently assessing the action by the governor. At this time, due to the need to have deputies available for emergency calls for service, deputies will not be responding to requests for face coverings or social gatherings only enforcement. What does that mean? That's Sheriff Barnes telling Governor Newsom to pound sand. And Sheriff Balaam, Chief Soto, I hope you gentlemen have the courage and the spine to do what Sheriff Coverly in Douglas County did, and Sheriff Furlong would do, and politely tell the governor that your deputies have other more important things to do, like protecting this community, and they will not be enforcing people at home or mask mandates or any of that nonsense. I hope you'll do it, because we at least deserve that much. All right, we're in northern Nevada. The death rate has dropped off. I don't care if there's more people being I don't care. Do your job. Your healthcare workers work. Okay? I'm sorry. I haven't stopped working either. My dad's a doctor. Everyone in my family's been working every day. All right? You don't like your line of work, go find a new line of work. Just like you teachers. You don't want to teach? Don't teach. Let someone else. There's plenty of people that want to teach. Okay? I know that might sound cruel, but right now we have too many kids dying and taking their own lives and going down way worse paths, and we don't need them at home doing distance learning anymore. No, we're going to cut that off, okay? We're going to stop that nonsense. And again, we're going to move forward in some other ways. All right, it's time to go to the next level, legally speaking, and try and end this nonsense. So again, everybody, there's always incredible information in my comments after these Facebook Lives. Please go on there, explore for yourself what's going on, and please protect your immune system. Get on that vitamin D, vitamin C, zinc, and get your azithromycin called in from your doctor. Have that on hand. And again, there's a medication that they'll put in my comments that you should get and have on hand, or at least have access to a doctor. And that's Dr. Bruce Fong, ladies and gentlemen, is my brother in arms, my brother from another mother, the Nevada Osteopathic Medical Association. I've had the privilege of representing these gentlemen, renowned, your pulmonary guys that are monitoring the ICU. Call Dr. Fong for a little lesson, okay? Have a little discussion with him, because if you're not giving this medication at the hospital, you're killing people, and you took an oath to do no harm, and you shouldn't do that. You shouldn't do that. You shouldn't play politics with people's lives. It's very, very uncool. And I hope there are some attorneys out there that are going to take some action against you that aren't giving people the ability to use medications that could save. This is a pandemic. You guys want to carry on like this and have these emergency directives, keeping everybody in place and enforcing these ridiculous things upon us, and you're not going to use any and all medications available, especially ones that have been approved and around for 70-something years? Like, did you bump your head? How stupid is this? Doesn't that sound stupid? I mean, come on, think about that. You don't like Trump, so you're not going to use it, or you don't like this, you're not going to use it, or why would you not? You try everything. I would expect you to try everything. You're my doctor. You're protecting my life, and I would expect that in that same line of thinking, the repercussion should be you didn't use all necessary means or all means necessary to save my life. I should be able to sue you and your hospital. So let's put that in motion real quick. Again, everybody, Joey Gilbert. I'm keeping this under 30 minutes. Do not let yourselves get locked down. stay open, adhere to the stupid protocols and the ridiculous things they're doing, the nonsense. But this is a day. Let me tell you something. I'm not saying the coronavirus is not real. I'm not saying it can't kill people. But we've just learned that the average age of death in the United States is 78 years old. The average coronavirus death is age 78 years old. So I don't know what to tell you. The CDC came out with their adjustment. You guys can say whatever you want, man. Only 6% of the people that have died out of the 225,000 now died only from the coronavirus. And it's going to come out to be less than 20,000 when it's all said and done. And then they came out more recently and did an adjustment, said 130,000 of the 220,000 were called wrong. Those were heart disease, okay? They were respiratory illnesses, cancers. So this isn't over, guys, by a long shot, this pandemic nonsense. But it could be over on how we allow it to affect us if we all stand together. It's that simple. Call me. You know I will help anybody at any time. I don't care what political. I don't care if you voted for Sleepy Joe. I don't care if you didn't vote. I don't care if you voted. I will help you. I will do whatever I can because this is insane. We are a community together. Election's over for now. They're fighting through all this nonsense. Okay, again, we won't even get into that. But all I'm trying to tell you is don't close your business. Get your kids back in school. Demand to return to normal because everywhere else where you see red, guess what? Normal school, normal sports, no mass death. Florida, has the 5th oldest population in the country. No mass death. Less death rate than we have. Explain that to me then, Governor Sisolak. Riddle me that one. Warm weather, older people. Yeah, I know, because it's all nonsense. So everybody, please, increase your immune system by eating healthy. Stay away from the alcohol if you can. The bad foods, the sweets, lots of carbs and stuff like that. Stay away from that. Vitamin C, vitamin D, zinc, and drinking lots of water. Getting that exercise. Take those masks off if you're by yourself. And before you put your mask back on, come on, moms. I've seen you guys. Hey, listen, and just one other thing, just so you guys understand something. My life is ruled by women. Almost all my staff, at least the women that run my office, or women run my office, and my executive assistant, my right hand, right? I have 3 sisters, Italian mother. I have a daughter. I have her mother, Molly, my Molly. Okay, so I have all women in my life, right? You women, you're the strongest. You are the ones making the most sense. You need to punch back. You need to fight back for your kids. What I was going to get at is you guys always have, I always see you breaking out the hand sanitizer out of the purse and the wipes come out of wherever. God bless you, right? Keep the hand. It's the most important thing you can do. Wipe down the space, use the hand sanitizer before you put on the mask, before you touch your face, before you swap the mask out. The masks are creating the problems. They're causing the more infections. They don't want to tell you that, but when this all comes out, you're going to see. You're touching your face, you're touching all over, you're touching your face, okay? So again, let's use our hand sanitizer. Let's wash our hands. Let's sanitize our workspace. Let's carry on with our lives. Again, Reno, Tahoe, Vegas, rural communities, I love you. I got you. I'm going to get you. I'm going to keep backing you. I got some stuff in the works. That's all I can say. And much love to all the attorneys and people helping me out there. You know who you are. I appreciate you so much. This state owes you, a lot. And again, just know there's a lot of silent warriors out there. There's a lot of people in my comments and supporting me. I would not be able to do what I do if I didn't have an incredible staff behind me and the amazing amount of people that are backing me up on these feeds and stuff. So again, Nevada, stand strong. Let's stay in the trenches and keep punching. Okay, let's stay in there. Do not shut your business. Do not shut your business. Don't even shut it down 50%. Stay open. Follow your little, protocol. Stay open. Up your immune system, get your kids back in school, get loud, demand the Washoe County School District to pull their head out, get these kids back in school. They cannot wait till the end of January. That's insane. Okay? I'm not going to get excited. I said I was going to get excited. I love you all. Good night. God bless.